After retiring, Bruce Willis had his final diagnosis confirmed by his wife, daughters, and his ex-wife and friend Demi Moore. Hello everyone, today we will bring an update on the health status of Bruce Willis, and talk a little more about the disease that kept the actor away from the public eye since 2022. This will be a slightly longer video, but it will bring important information about FTD. Don't forget to follow our channel and like our posts. Thank you. Actor Bruce Willis, 67, has reached an advanced stage of his disease, for which there is no treatment. Willis was diagnosed with frontotemporal dementia. The information was released by his wife, Emma Hemming Willis. His ex-wife, actress Demi Moore, also updated the artist's health status through one of her social media platforms. Emma also left a link on her profile with the full statement, also signed by the actor's daughters, where they explain the details of the seriousness of the disease and its incurability. I hope it will be a source of much more awareness and research. Less than a year after announcing that Bruce Willis had been diagnosed with aphasia, the actor's family released a more specific diagnosis on Thursday. The 67-year-old artist has a type of dementia, currently incurable, called frontotemporal dementia. According to doctors, aphasia, which generates language impairment, manifested by difficulty speaking or understanding others, is a frequent first sign of frontotemporal dementia. Aphasia can have several causes, such as a stroke or a brain infection, but when related to a dementia such as frontotemporal or Alzheimer's and other signs, it is characterized as progressive primary aphasia, PPA. According to a study published in October 2022 in the scientific journal Nature Communications, FTD is responsible for 5 to 10% of dementia cases. The most common type of dementia is Alzheimer's. As the name suggests, frontotemporal dementia affects the frontal and temporal regions of the brain. In addition to language difficulties, more associated with the impact on the temporal region, frontotemporal dementia can manifest in behavior related to the frontal region. According to neurological experts, the diagnosis of this dementia never occurs in a first consultation, but over time. Clinical diagnosis, that is, from the doctor's own care, is the main way to detect the disease, but it can be complemented by imaging exams, genetic analysis, and cognitive tests. In fact, it is this combination of information that allows differentiating the type of dementia, for example, FTD from Alzheimer's. Without this combination of information, the possibility of misdiagnosis increases significantly. The disease is progressive, which means it cannot be reversed and the condition tends to worsen over time. Only symptoms can be treated. There is no medication that changes the natural course of the disease. Treatments are medications for the behavioral part and multidisciplinary therapies, such as physiotherapy and speech therapy. Frontotemporal dementia, FTD, often manifests before the age of 60, more precisely between 45 and 65 years old. This is a different characteristic from Alzheimer's, which tends to appear later. The study published last year in Nature Communications stated that, in about 15% of cases, FTD is related to a specific mutation in a gene. According to doctors, this form of dementia has a strong genetic background even more than in Alzheimer's. Therefore, the same family may have more than one person manifesting FTD over time. The patient gradually loses their ability to communicate, which also causes a lot of suffering for the family. In the statement released this Thursday, Willis's family expressed hope that the actor's situation would help raise awareness about the condition. Those were our personal updates. We hope that Bruce's illness progresses in the least painful way possible for him and his family, and we also hope that, like his family, the actor can be an important starting point for the ongoing development of diagnostics and treatments for FTD.